We welcome you to our module Portal Hypertension, HCC 27 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of portal hypertension. At the end of this module, the learner will be able to define portal hypertension and identify its symptoms. Discuss the criteria for the documentation of portal hypertension. Review the example of the assessment and plan for the disease. Portal hypertension is defined as an increase of portal blood pressure over 5 to 10 millimeters of mercury. After which, the portosystemic shunts open when the venous portal liver gradient becomes higher than 10 to 12 millimeters of mercury. A portal vein is the vein that carries blood from the digestive organs to the liver. The pressure within the portal vein increases due to a blockage in the blood flow through the liver. The increased pressure causes varices or large veins to develop across the esophagus and stomach to get around the blockage. After some time, these varices become fragile and susceptible to bleeding. Portal hypertension is caused by cirrhosis of liver. Cirrhosis occurs when the scar tissues block the blood flow through the liver and slows down its processing functions. However, it may also be caused by thrombosis, a blood clot that develops in the portal vein. The onset of portal hypertension may include symptoms such as gastrointestinal bleeding, ascites, encephalopathy, and reduced level of platelets. The criteria for the diagnosis of portal hypertension include a physical examination and diagnostic tests. For physical examination, the examiner should check for increase in abdominal girth, abdominal pain and fever, anterior abdominal wall dilated veins, caput medusae, tortuous perumbilical collateral veins, rectal hemorrhoids, ascites, cyanosis of the tongue, lips, and peripheries, and other signs and symptoms. The diagnostic tests include abnormal liver function tests, abnormal liver enzyme levels and hematological testing, abnormal metabolic findings, CT scan, MRI, liver scan, biopsy, and an ultrasound of the liver to support the diagnosis. Let's look at the ICD-10 codes associated with portal hypertension. For chronic hepatic failure without coma, the code is K72.10, HCC 27. For chronic hepatic failure with coma, the code is K72.11, HCC 27. For hepatic failure, which is unspecified without coma, the code is K72.90, and the HCC value is 27. For hepatic failure, unspecified with coma, the code is K72.91, HCC 27. And lastly, for portal hypertension, the code is K76.6, HCC 27. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of a progress note. Patient name: Joanna Wilson. Date of service: January 8, 2019. Date of birth: February 21, 1986. Assessment and plan: portal hypertension, advised patient no ethyl alcohol, healthy diet. Comfort and support measures in place. Return to clinic monthly to monitor. We have reached the end of our short refresher course on portal hypertension. We gave you a short introduction to the disease, identified the criteria for the diagnosis of portal hypertension, noted the ICD codes that fall under the disease, and finally reviewed the assessment and plan for portal hypertension. Thank you for joining us.